Hi everyone, we are doing the cardiovascular system, and you're hearing from Team LubDub. Maybe you were today years old when you found out that your heart doesn't actually look like this. It looks like this. And we are here to explain exactly how it works.
Meet the heart. The heart is made up of 4 chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. Blood flows from the body to the heart through and collects in the inferior vena cava and the superior vena cava. And we're going to put a blue arrow because it's unoxygenated blood, and the blood returns into the right atrium. And when the muscle contracts, it pulls these papillary muscles down and opens up this tricuspid valve, and the blood flows into the left ventricle. The left ventricle then contracts and squeezes the blood up through the pulmonary valves, which is a semilunar valve, into this pulmonary artery to the lungs. And then from the lungs, the oxygenated blood returns to the heart through the pulmonary veins and enters into the left atrium. From the left atrium, when the heart contracts again, this other mitral valve opens and the blood flows into the right ventricle. And from the right ventricle, when this myocardium contracts, all of the blood flows up and through into this aorta here and out to the body.
Before we begin, we're going to get started with the anatomy of the heart. So to begin, we have the right and left atriums and the right and left ventricles. Blood comes in and flows through the right and left AV valves, which are located here, which are pulled on by the tendinous cords that are attached to the pulmonary muscle. These are pulled on by the papillary muscle. Blood flows through the aortic valve and the pulmonary valve that are semilunar, meaning that they don't completely close when the heart contracts.
Here's a quick fun fact before we transition into some other more interesting things. This is me at the Science Center the other day. And your heart beats about 1,500 times a day. Plus, most heart attacks happen on Mondays. Good thing it's a Tuesday. Did you know that Christmas Day is the most common day out of the whole year for heart attacks to happen? Heart cells stop dividing, which means that heart cancer is extremely rare. Also, it's possible to die from a broken heart. Broken heart syndrome has a similar symptom as that of a heart attack. The average human heart weighs less than 1 pound. However, a man's heart on average is about 2 ounces heavier than a woman's heart. So let's get into it. The walls of veins and arteries are composed of 3 layers, called tunics. First and most internally, there is the tunica interna. This is a layer that is exposed to blood and made of simple squamous epithelium. The tunica media is strong, so it cannot be ruptured. The third and most outer layer is the tunica externa, which is made of loose connective tissue. The tunica externa makes sure that the vessels do not move around inside your body. Quick fun fact, the average human heart is the size of your fist.
Hello, darkness,
Moving forward, let's talk about arteries. Arteries are more muscular than veins and can be categorized into 3 separate classes. The first class is a conducting artery. These type of arteries include the aorta, pulmonary trunk, and common iliac artery. These arteries have 40 to 70 layers of elastic sheets. Conducting arteries harden as you get older. This means as you age, the arteries have a greater risk of hemorrhaging or having an aneurysm. And the second class is the distributing arteries. These arteries include the brachial, femoral, and retinal arteries. These arteries have up to 40 layers of smooth muscle contributing to their thickness. The third and final class is the resistance arteries. These arteries are so small that they aren't given individual names. These small resistance arteries push blood into the body's capillaries. An interesting fact about resistance arteries is that in comparison to conducting arteries, resistance arteries have a thicker tunica media than those of a conducting artery. There are 3 different types of capillaries. There's continuous capillaries, which are present in skeletal muscle. Then there's fenestrated capillaries, which allow a route for smaller molecules. And finally, there are sinusoids, which are irregular blood-filled spaces within your body.
So after blood leaves the aortic arch, it flows through the rest of the body via arteries. So main arteries of the arms are the axillary artery, which then turns into the brachial artery, which then branches into the radial artery and the ulnar artery. And then it also goes to the lower extremities via the femoral artery, and then the anterior tibial artery and the dorsal pedal artery. Once the arteries have brought in the blood to the parts of the body, it is then the deoxygenated blood is then brought back to the heart via veins. Some major veins of the arms are the brachial vein, the cephalic vein, the basilic vein, the median cubital vein, and then some major veins of the legs are the femoral vein and the great saphenous vein.
She's dead.
I'm napping.